Hi everyone, welcome to my channel. This is your girl Nurse Ify again coming to you. If you have not subscribed, please subscribe. I am so grateful for those of you who have subscribed. I am so grateful. I am now on 38 subscribers and it means a lot to me. Thank you guys. Today I am going to be talking about head to toe assessment. Head to toe assessment. So when you're doing head to toe assessment, the first thing you do, I'm going to be looking down because I have some write up. The first thing that you do is you're going to look at the general safety of the patient and of the room. So you have to kind of survey the room, make sure that like things like walker and things like wheelchair, it's not on the way, you know. Then you also have to make sure that the bed is raised up. So you raise the bed up, so that way you don't have to bend down so low to um, having contact with your patient. So first thing foremost is the general safety. Make sure that the bed it's in the right position. Make sure that the call light is close to the patient. Make sure that the emergency equipment are out of the way or anything that can cause a fall hazard is out of the way. It's taken care of. So then you look at the patient. When you look at the patient, what you're assessing is their mental status, the general overview of this patient. You want to know what are the mental status of the patient. Is he alert and oriented? Is he confused? Is he lethargic? Um, does he know where he is? Does he know the name of the facility? Does he know the president? Who is the president of? Can ask questions like, "Who is the president of United States?" Common questions that they will know, like what is their date of birth. You can ask what is the name of the place you are, to ask them to tell you their name, or even ask them what are their social security number. These are the things that those are the kind of basic things that they answer. So when they answer one correct and the rest wrong, so it's getting only 1/4. But if you answer 3/4, then it's 3/4. But if he answers like 4/4, he is a lot. If you answer three is a lot, and but when it's like two or one, I usually don't give them a lot. They are pretty confused a little bit. So then you check the vital signs when so we are checking the blood pressure, the vital signs which comprises of the blood pressure, the temperature, the respiration, the heart rate. So you are checking, you check all that and then write it down. Then you start from the head. So you want to see if the head is symmetrical. Is there any like pushing in the head? Or is this side swollen and this side not? You want to look at the eyes. Is there any drainage, any swollen, any kind of boil in the eyes? You look at the nose. Is the nose symmetrical? The mouth, then the ear. So you want to see, is there any drainage? These are the things you are looking at. You're looking at the ear to see if there is any drainage in there. You look at them at do they wear glasses? Um, you are they able to swallow very well? What is the color of the face? Is there any rashes, any kind of impairment? This do they have any hearing problem? These are all the things you are assessing when you look when you start with the head. You want to see if the patient can swallow. How does he talk? What are his verbal? Is he able to talk to me? Is it any? um, or nonverbal. So that is something that you need to know. And secondly, then we go to psychosocial. So you want to know what patient's behavior um, and the effect of this patient. So another thing oh, is objective and the subjective um, data. Okay, when the patient is the one telling you is subjective, he tell you something, probably you ask him some question or he said something, oh, my weight is this amount, maybe he said my weight is 12 kilogram. That is subjective. But if I find the weight by myself, like if I obtain the vital sign, if I obtain the weight, it is objective. That is an objective data. So that's one thing I want to bring in, because while you're doing assessment, there are some certain questions you need to ask the patient, and there are certain things that you need to observe and see for yourself. So then you will go down into the chest area. So when you look at the chest area, you are also looking at the color of the chest, looking at the moist, you're looking to see if there's any lesion, the quality of the respiration. Is the patient, is he breathing normal? Is he having any difficulty breathing? So these are the some of the things that you are looking at. You are looking at you're also their heart sounds. These are all some of the things you're going to use, and this you're going to use a stethoscope to listen to it, to be able to see the heart sounds, the lung sounds, and all that. Okay. So, and you're going to ask him some subjective questions. You want to get some data like, do you cough? If you cough, how often is it? Does he cough? Is it if he cough, does he have any production, anything coming out of it? And if he says something is coming out of it, is it clear? How is it? What's the color? Is it yellow, clear, dark, brown, whatever? So you want to know all those colors. So another is the abdomen. So the abdomen, you want to look at the abdomen, the color of the abdomen. If there's any lesion, then you have to listen to the bowel sounds. In the bowel sounds, you listen to it in the four quadrant area. So what it is you kind of use your eye to divide the stomach through the um, you divide it into four places, um, through the umbilical cord where our nerves. So here, so you kind of divide it into four. So the first one, right upper, left upper quadrant, right upper quadrant, left lower quadrant, right lower quadrant, then left lower quadrant. So this is the way. Let me do it again. You listen here, you go to this side, then down here, down here. So systematically. So you don't just listen here and jump to this side and then jump to this side. So if you listen here, you go this way and go this way and go this way. If you listen here, if you start here, you go here, 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 or you go in here, 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 here. So you listen here, you compare to the one on the right upper, the left upper, right upper, left lower, right lower. Kind of compare the two of it to see what are the difference, if it is hyperactive, if it is hypoactive, then you kind of know. Then when you're in the abdomen, after you finish listening, you also can palpate it to see if there is any mass. When you're palpating, you are looking for mass on the um, abdomen. Those are the things that you are looking for. Then on the upper extremities, you want to check the skin color, the any artery temperature. You want to see for the tenderness. If there's any edema, you want to check the strength, and you want to check the for capillary refill. How do we check for capillary refill? You pinch the hand, and then if it goes back right away, then it has a very good capillary refill. But if it doesn't go back, that means it does not have a good capillary refill. And most times in the patient with that has edema, which is swollen or excessive fluid that is stored in the in the system, that it's not in the right place. So when you press it, it stays there. It takes a while for it to come up. You press their fingernail, then it just goes in there and stays there. But if the patient has a good capillary refill, as soon as you take your hands off, it will rebounce back to where it is. So when you are checking the extremities, you want to check for any tenderness. You want to touch them to see the temperature. Is it warm? Is it cold? You also want to check to see if there is any capillary refill. You want to check for strength. You want to check for sensitivity. So for me to check for sensitivity, you gotta like pinch the patient. Sometimes some people use like a sharp needle to do that, needle or some sharp object to do that. But especially for our elderly patients, I will not advise that because their skin is already tender. So if you kind of just pinch the patient a little bit with your fingers, and you can feel, they will feel the pain. So if the patient is sensitive to pain, you will see him just jump. But if he's not sensitive to pain, he will just be there. So that tells you. So like patient with stroke, so when they have a stroke in the hand or anywhere in the body, you pinch them on that hand because they are not having circulation go in that part of the body. They don't have that sensation. So secondly, if you want to check for strength, I always ask them to hold me, hold me. Then I try to pull back while I'm pulling you. Then the patient will pull back. So if they have strength, they pull back. If they don't have strength in that hand, say for instance, the patient has a stroke in this hand, and then this hand is a strong hand. So when I'm pulling with this hand, he's going to be able, when I ask him to pull me with this hand, he's going to be able to pull me with this hand. But this one is just going to be there. It will be weak. And sometimes he may not even be able to grab me with it. The same thing on the leg. I wish I have a dummy here or somebody to use to demonstrate. But for the leg, as the patient is laying down, you push him back. You put your hands towards the leg, towards the feet of the patient. Ask him to push back, to push you back. And while you are pushing, ask him to push you back. Then, if he has strength, you push back, or as you can push him and ask him to resist. Sometimes some people do it on the knee. When I go to my doctor for yearly checkup, he usually push my knee and trying to ask me to push back and all that stuff. So he's checking the strength to make sure that the strength is equal on both sides and all that. So you do it at the same time. You don't do one and then do the other. You do it at the same time. Push uh, the feet, and then ask the patient to push you back or something. So while you're pushing, so things like that will be the way to check for the upper and the lower extremities. So on the lower extremities, you do the same checking. You check capillary refill by pressing the toe. You also check for edema, check for redness, check for warmth, and what are the causes of warmth? It could be an infection. So if the that area of the body, say this area of the body is warm and this one is cold, there could be some infection, something going on around here that need to be addressed. Yeah, so that is one of those stuff that I really need to come to you about when you're doing your assessment. So we really need to look at all that, then check the patient to see if is this patient on oxygen. If it's on oxygen, the pulse ox is going to tell us how the patient is doing. If it's not on oxygen and say the pulse ox is 80 or 88, what did you do? Give the patient 2 liters of oxygen. Make sure you call the doctor. You can give 2 liters of oxygen, call the doctor. I think most of them are good with it. But you still have to get a doctor's order because oxygen is a medication. So, but if the oxygen is anything below 90 degrees without on through with air, the patient needs some oxygen. What does oxygen do? Oxygen help to supply in our brain. So without oxygen, we will not last for so long. So it is very important and it is an urgent thing to do for your patient. So when you are doing this assessment, like I said, when you look at the hair while you're at the beginning of this assessment, I say start with the hair. You can also look for the underneath the hair. You want to check, what are you checking? You're checking their scalp for dryness, for lice, especially for the school age kids. It is very important when you're doing the assessment on their hair to assess them for lice. Because even the elderly, some of them you still see it on them, elderly and the homeless. So you assess the hair for lice and all that. So those are the kind of like the beginning of your assessment. So you kind of start from hair and then walk down. If it's a woman, when you come to the breast area, please lift up the breast and see if there is any yeast infection on the underneath. And it could be, if it's dictated, it can be treated at the same time. So when we come to the down down here, let's look at the back, the bottom very well. Sometimes some of this elderly population, they have a bed sore and they are diabetic, they are not feeling the pains. They have a bed sore which nobody has been able to dictate or address. So we can do them a favor. We are patient advocates and we can do a good job. If we do a good assessment, it will help with taking care of these people. We can dictate something even the regular nurses or the staff has not been able to dictate because they are busy or something. But as students, we are always have one patient. So with this one patient you have, I want you to do a thorough assessment. Check underneath the breast, underneath the folds. Some of the big ladies you see, they have the abdominal fold. Look into the abdominal folds because you could find some yeast infection building up there. Yeast love somewhere that is moist, and if treatment is started on time, that will help and save life. Thank you, and make sure you subscribe. I'll see you in next video.